You know, we're in the throes of something that is extraordinarily important to really tens of millions, probably hundreds of millions of Americans, which is our national healthcare policy. And abandoning my cautious nature for a moment, I'd like to really speak about my own personal opinion about what's going on, because it is so paradoxical and so internally contradictory that I really can't even understand it. So I'm really asking for you to help me to kind of rationalize what the heck is going on right now. I want to go to this most recent situation with Mitch McConnell, the leader of our Senate, pushing through, and I want to emphasize pushing through with political pressure, the vote to move forward with the rescinding of the Affordable Health Care Act, in the absence of any really clear plan as to what the alternative would be, other than the rumors that we get, obviously, from the plan that was already passed by the House and the proposed plan that we've seen from the Senate, that the new substitute would remove literally millions and millions of people from health care through the constriction of Medicaid. So the real question is, what health advantage does the present ability to reach out to people of less financial opportunities for supportive health care provide in terms of health for our country? And is there something paradoxical about all of this debate that we should be aware of? And so I was reminded in my thinking that Mitch McConnell is a senior senator from the state of Kentucky, which then asked the question, what do we know about health in Kentucky? So if you're not familiar with that, let me just remind you that the trending of health, which is done annually, kind of health assessment on a state-by-state basis around the United States and ranking, that if I look back at statistics from 1990 to 2016, where the data is available, that the trending for where Kentucky as a state ranks in health is somewhere between 47th and 45th, lowest in the country out of 50 states. And what is the reason for that? The reason for that is ostensibly because Kentucky has a very serious burden of what we would consider reducible chronic disease. Chronic disease associated with lifestyle principles. So you might ask the question, does increased accessibility to Medicaid have anything to do with the changing of the outcome of health in Kentucky? And ironically, Kentucky is one of the 3 states in which a study has been done to examine whether Medicaid expansion, which occurred under AHA, would have any benefit on reducing the burden of unnecessary chronic disease. In fact, those 3 states included Kentucky and Arkansas and Texas. Kentucky expanded its Medicare, making it more accessible to people of low income. Arkansas either expanded their Medicare or allowed for new options of private insurance at lower cost, and Texas did nothing. And so they compared health outcome of those 3 states to see if there was any advantage whatsoever that could be demonstrated in health outcome. And lo and behold, it was found out that it extended their health care coverage to people of lower socioeconomic capability, that there was a reduction in the use in chronic disease, improved use of preventive care, increasing medication adherence, and a general statistically significant improvement in health. Now, that was so profound in its outcome that there are actually some very nice studies that were done by senior faculty at the Harvard School of Public Health. I'm now quoting from an article that appeared in JAMA Internal Medicine in October 2016, entitled Changes in Utilization and Health Among Low-Income Adults After Medicaid Expansion or Expanded Private Insurance. And what did they find? This is the results of the study, or the intervention I described, of the difference between Kentucky and Arkansas and Texas. And they go on to show in this paper that, lo and behold, among the 3 states, that Kentucky and Arkansas that expanded coverage under AHA to lower income individuals had a statistically significant improvement in overall health versus a state, Texas, that did not. They say aside from the hype of coverage obtained, outcomes were similar, and the 2 states where alternative approach to expansion were allowed led to improved health of the average individual in the state. There are a number of other studies that have supported this same concept. Low-income residents in 3 states view Medicaid as equal or better than private coverage in a paper that was published in Health Affiliates in 2014. There's another New England Journal of Medicine paper in 2012, Mortality and Access to Care Among Adults After State Medicaid Expansions Under AHA, showing again the improved health outcomes that occurred as a consequence. So here's Mitch McConnell, our leader in the Senate from the dominant party, who is saying that we don't need to have expansion of Medicaid, that in fact what we need to do is cut back on those expenditures in a state that is ranking between 45th and 47th in health outcomes in the country at large, in which the only time that it has really shown any significant improvement against headway against this problem was when Medicaid was expanded to individuals of lower income, providing them an opportunity to have health care. What's wrong with this? What's going on here? Help me understand. I don't understand any of this when we have data in hand that clearly shows that expansion of Medicaid into people of lower income capability will result in improved health and reduced burden of disease. It's unfathomable to me that this is still being argued. Help me understand. Thank you.